The article I covered was over effects of transcutaneous electrical nerve stimulation on acute postoperative pain intensity and mobility after hip fracture. The objective of the study was to determine the effect of incorporating transcutaneous electrical nerve stimulation, also known as TENS treatment, on pain intensity and mobility, along with rehabilitation care during the postoperative phase following gamma nail surgical fixation of extracapular hip fractures. And TENS is a non-invasive modality which can be used to reduce acute postoperative pain. 41 patients were randomly assigned with a mean age of 79.3 plus or minus 9.2 years. Supplement of 30 minutes of active TENS or sham TENS. Standard rehabilitation care included 5 daily 30-minute physical therapy treatments beginning 24 hours after surgery. Outcome measures were pain intensity at rest, at night, and during ambulation, assessed with the numeric rating scale, functional ambulation classification instrument, time to complete 5 sit-to-stand tests, and 2-minute walk tests. Data were analyzed with Wilcoxon score rank test. Significance was set at p less than or equal to 0.05. This is an example of the functional ambulation classification instrument. There was a significantly greater pain reduction during walking in the active TENS group compared to the sham TENS group. The difference between the 5th and 2nd days was 2.55 plus or minus 1.37 versus 1.06 plus or minus 1.11. P equaled 0.0011. TENS also showed a greater increase in walking distance on the 5th day, along with a higher level of mobility compared to the sham TENS group. No additional effects of active TENS were shown on the pain intensity at rest and at night on the 5-time sit-to-stand performance between the groups. However, both groups still showed improvement within the group themselves. The addition of TENS to the standard care of patients following gamma nail surgical fixation of extracapular hip fracture is recommended for pain management while walking, along with functional gait recovery. The effect of TENS on long-term functional outcomes should also be explored. This study shows that transcutaneous electrical nerve stimulation, also known as TENS, treatment should be used more often following gamma nail surgical fixation of extracapular hip fracture to help with the functional gait recovery. In conclusion, the results might have been different had they had a longer time frame rather than just 5 days. To better this study, I would have made the time frame longer than 5 days to determine the long-term functional effect of the TENS treatment.